Perfect. Well, good evening, everyone, and thank you for being here today. It's uh, it's going to be quite a tight schedule that we're working on because we only have an hour to get through, and there's a lot that I'd like or intend to cover today. But just to clear from the outset, if we don't get to the thorax, which is the scientific name for the chest, we can continue on next week. So there isn't a rush to get through it all, but ultimately we want to make sure that we can get through as much as we possibly can. Now, for those of you who don't know me, my name is Fahim. I'm a pharmacist prescriber, contractor, and the founder of Medlen. And Medlen is a training organization that gives you the clinical skills. And it was developed at the back of a survey that was done by the GPHC in 2016, and my own personal experience of not being able to utilize my prescribing qualification. And as a result of my journey, I went on to set up Medlen, which gives you the clinical skills, in addition to allowing you to be able to put your skills into practice and being able to market that product. Now, you can have a great product, but if you can't market your product or you're not able to talk about it, you can't make a difference to lives and so forth. So that's a brief summary about Medlen itself. And the plan today is that we're going to be spending an hour together and looking at different areas of anatomy. We're going to be looking at the thorax near the second portion. And initially, I want to start off by explaining to you how you can get the most out of this webinar, but also what to expect from the webinar, which I'll be discussing shortly with yourselves. We'll also be looking at a brief history of anatomy. We'll be looking at how you'll study anatomy and where you go forward from here. So some of you've got in touch with me and have asked me various questions with regards to what do you expect from the webinar. Now, the webinar is a brief introduction to the various clinical topics. It is not a substitute for the learning and the dedication that you have to put in. That is really, really important. Unless you're able to somehow transmit 20 hours of learning, or in the case of some of the doctors, 20 years of studying anatomy in the space of 1 hour, you're not going to be able to, put that into practice. So this is going to give you the basic tools and to familiarize yourself. So if you do go pick up a textbook on anatomy, or you read a particular area that concerns anatomy, you're able to put it into practice or able to understand. The webinars also prepare you for the training that we offer at Medlen itself. Okay, it's an adjunct, it's a supplement, it is not a replacement. So that is clear from the outset that this is going to give you, we're going to touch on the surface of certain points, but we are not replacing the time and effort that you have to put in. So what are the learning outcomes? Well, at the end of this webinar, what I'd like to achieve is for you to have an understanding of the importance to continually learn and educate yourself. By the end of this webinar, you're going to know stuff, or you'll be able to relate to things that you already know, but there's also going to be a lot of questions that you probably may not, have needed to think about, or knowledge that you might not have been aware of. You're also going to get a first-hand experience of the quality of learning that we offer at Medlen itself, in addition to familiarizing yourself with anatomical terminology, which is going to be something important. And then hopefully we'll be looking at the thorax itself. If you don't have a pen and paper, I would recommend that you do have something to hand, because there might be some points that you want to just quickly jot down. So why did I start off with anatomy? I could have easily picked something like physiology. We could have talked about, physical examination or clinical history taking, could have been pathology. But in order to understand why I picked anatomy, it's going to be important to understand what is anatomy. So a textbook definition of anatomy is the scientific study of the body structures, okay? Another word for that would be morphology. So what morphology actually means is when you're looking at structures, you're able to describe structures, you're able to locate structures, you're able to understand a bit about the function of these structures. That is what anatomy is. It's talking about structures, locating structures, and it's giving you that understanding of possibly how these structures may work. Now, something that is important for you to understand is the terminology that we use in anatomy. It's a standard terminology, irrespective of where you are in the world, it's the same terminology used. For example, the bone that's between your knee and your hip is known as the femur. Now, it doesn't matter if you are taught in medicine in China or if you're taught medicine in Africa, it is exactly the same term when you're describing it from an anatomical perspective or using anatomical words. And the reason for that is because we want to reduce any sort of ambiguity that can possibly happen. You might describe one area as a thigh, somebody else might describe it as the leg itself. And interestingly, it's actually, a bunch of anatomists got together around the 1980s and agreed upon this international structure. And you can find it on this, you can search as a compendium known as the Terminologica Anatomia, which you can search on the internet, and you can find all the various anatomical words and language. What I found is in order to become good at anatomy is you need to be able to definitely memorize terms, and how you can actually learn to memorize these terms, it might pay dividends if you can understand where the terms come from. Now, I'm not suggesting that you go on and you take a course on Greek or Latin, because a lot of the terms come from there. But if you're able to relate some of these structures or these words with their roots, it would make sense. For example, let's look at the word anatomy. So if we break down the word anatomy, we have ana and toe. Toe means cut and ana means up. So anatomy is basically the study of cutting up stuff. And if you look at it traditionally, that's what they used to do. When you wanted to find out a particular structure, or you wanted to learn about the human body, you would, what we now call dissection, you would open up the human body, have a look at various parts and start to describe them. And somebody who was credited for this was a Belgian physician known as Andreas Vesalius. And this particular gentleman was very respected for his drawings and his work that he did for anatomy. And this was back in the 1970s, or possibly even slightly before that. And he was, he had great pictures and great, great work. We also know of there's various individuals that have been heavily credited for being able to do all these structures. So that is just a bit of a backdrop about anatomy itself. The key to this is going to be you memorizing and understand and trying to possibly understand what the terms actually mean. In anatomy, what I've learned, there isn't really a why. It is not physiology, it is not pathology where you can try to understand, why do we call this bone the femur? Or why do we call this bone the tibia? Why do we call it the ulna? That's just what it is. That you can, why they call it that or who decided that, that's just tough. That's just something you just have to know. Why we teach you anatomy in any healthcare field is so you can build on your knowledge. Now, this is a really important point, because if you're not able to grasp certain areas of medicine, you can't build on the knowledge. Think about your study in pharmacy. If you don't have the basic understanding of chemistry or physics or biology, you cannot possibly go on to complete a master's degree in pharmacy. The same thing with studying medicine. You need to be able to name parts. You need to be able to understand where these parts are. And you also need to be able to understand the structure of these parts. Once you are able to name parts, relate to parts, you can build on that knowledge and then go on to develop your understanding of how these parts work. If you don't know what the valves of the heart are, for example, the aortic valve or the pulmonary valve, possibly how they function, there is no way you're going to understand why you get a murmur or possibly the different heart sounds, S, S3 and S4, because you don't have an understanding of what these structures are, where they are and what they do. if you don't understand that the purpose of valves is to stop backflow of blood, you're not going to understand how the cardiovascular system works and what can happen when things go wrong. So it's really important for you to understand that. How you study anatomy. Anatomy can be studied in two ways. We have gross anatomy and microscopic anatomy. Gross anatomy is basically you describing structures and location based on what you can see with the naked eye. So we don't involve microscopes at this level. What you're doing, you're looking at the human body. For example, I can see the chest, or I can see a bony prominence, possibly in the shoulder, for example. Or if you undertook dissection and you thought, okay, here we go, let's dissect the abdomen, and I can see the stomach, that is gross anatomy. Some people might think gross anatomy means, oh my God, it's gross, you're opening up things, it's, the structures that are there. That is not really what it is. Microscopic anatomy is basically where you're looking at these structures on a cellular level. And I'll get back to that in a moment. So we can study anatomy by looking at it through the naked eye, or we can study anatomy at a microscopic level. When you are studying anatomy through the eye, this can be further subdivided into regional anatomy, surface anatomy, and systemic anatomy. And any textbook that you pick up, whether it's Gray's Anatomy, whether it's Netta, what you'll find is that they will orientate you towards a certain type of anatomical, learning. And normally it tends to be regional anatomy, and that's where you're looking at a particular area of the body. For example, let's say the thorax, which is the chest, and you look at the chest and you'll start to describe the structures that are in the chest. For example, the heart, the lungs, the rib cage, and so forth. You could then move to the abdomen and describe the stomach, the spleen, the kidneys, or you can describe, you can move on to another region, which may be the head and neck. Systemic anatomy is where you combine anatomy with systems. So the human body has around 11 systems. You've got the cardiovascular system, you've got the reproductive system, you have the endocrine system, the muscular system, you have the integumentary system, you have the immune system. There's 11 different types of systems, and you could, in theory, study anatomy based on systems. But what I found is that can get a bit too heavy, because if you're studying the cardiovascular system, you're going to be discussing the heart and the peripheral vascular system. So basically, you'll be looking at the various structures. You're not only going to have to learn the structures of the nerves that are in the heart, but also on the periphery, which is everything that moves outside from the heart itself. So it can get a bit difficult. Instead, you might want to focus on just sticking to regional anatomy. So if you're learning about the thorax, you're focusing on the chest, but then moving to the heart, that's the thorax done. Then we move on to the abdomen, and that's the way that I would prefer to learn and teach. Surface anatomy is what you'll all be able to relate with, and that is more towards clinical anatomy. That is whereby you can put your learning into actual context. Surface anatomy is where you can see structures through the naked eye without you having to delve deeper inside those structures. For example, if you have an individual who walks, for example, let's say we wanted to locate the heart. There are certain structures that you can feel or palpate. So make a note of the word palpate. Palpate is the anatomical or the medical term for examining, touching, and feeling. And you'll be seeing a lot, you'll be hearing a lot of that, you'll be reading a lot of that. So if you were to palpate, for example, your breastbone, you could, and we'll be discussing this, in theory, quite easily locate the top of your heart. And that is surface anatomy. It's where we're looking at the surface structures and relating them to the underlying structures. Because unfortunately, you do not have the privilege, and I'm sure it wouldn't go down to, well, if you started to dissect every patient that walked in because you wanted to confirm, what was happening underneath. That is surface anatomy. Microscopic anatomy, which I think is equally as important, is where you're looking at the structures, you're looking at the various locations of these structures on a cellular level. And you might wonder why that's important. And that is because everything that happens in your body is on a cellular level. When you walk or you get visit a GP or a doctor or any prescribing or any physician, and you complain of pain that's occurring in the throat and you're diagnosed as having tonsillitis, what your doctor is treating is the cells of the tonsils, because they are the ones that are damaged or have become pathological, meaning they're not normal. That is what you're treating. I won't have anything more to say on that other than always remember that everything happens at a cellular level. You start as one cell. When the sperm and the egg fuse, it forms a zygote. That then develops into various germ layers, mesoderm, endonectoderm, and so forth. But ultimately, everything that happens is on a cellular level. Just keep that in mind. And that you'll be able to put things into perspective. For example, just a quick point, when you're having, let's say you're having a meal that contains chicken. That chicken is actually made up of muscle cells. What you're eating is muscle cells. When bacteria go inside your body, for example, cause sepsis, what they're destroying is your cells. And because they destroy your cells, your body then has to react. Everything happens on a cellular level. Okay, just keep that in mind. So I hope I've made it clear why anatomy is important. And the reason is so you're able to describe parts properly, you're safe, and also something on a practical level. If you're looking to upskill yourself and you're having a conversation with another healthcare professional and you're not able to use anatomical terms or words, it's not going to reflect too well on you. Ultimately, if you're working towards advanced practice, you need to be in a position where you're able to make the final judgment. Whether that means to be referred to a GP if it's appropriate or to a consultant in hospital, you make that call. It is not going to be good enough to say that I think this patient has an infection and I think the ear is burst open. What part of the ear? Is it the tympanic membrane? Is it the acoustic media, which is basically your ear canal? Or what part of the ear? You've got to be at that level. As pharmacists, I cannot stress that enough. You need to make sure that you are off that level so you gain that respect. We won't go into too much about where we view pharmacy at the moment, but ultimately you need to be, I'd like you to be the best of the best, so you're able to really, so people get a great service from you. Okay, and this will go a long way. And ultimately, the more knowledge you have, the more you're able to spread that knowledge, and the more you'll have people actually be interested in what you have to say. So, quick summary before we go into the terms. I've explained to you what anatomy is. And anatomy is the scientific study of the various structures of the body that is also known as morphology. Anatomy also includes the development of the human body. It does include embryology, because ultimately that's how it all started, but we are not going to be delving into that. But if you were to pick up a textbook on any anatomical textbook, what you'll find is it will talk about embryology. The study of anatomy can be broken down on a gross level or a microscopic level. We've discussed gross anatomy means what you can see, the structures you can see, the structures you can feel. Microscopic anatomy deals with the same structures, but on a cellular level. Anatomy is important because that is what you're going to build your knowledge on. These are the only 4 points that I think will be the takeaway from why you need to learn anatomy. We're now going to have to look at the standard anatomical position. And I'm really going to hit home on this because I'll give you an experience that I've had with this. Before you can start to use the anatomical terms, you need to know the positioning. Now, if you have a look, I'm just going to confirm actually with Michael quickly if you can see possibly my, if you can just confirm that you're able to see my mouse, because I'm going to be pointing.
Yes, I can.
You can see my, perfect, that's fine. Okay, great, thank you. So the standard anatomical position, this is your reference point. You need to get your head around this. You always, always, always must remember that when you are describing a structure, this is the orientation. And I'll explain to you my learning from this. The orientation is that the individual in question is upright. He's not sat down, he's not lying down, he's not crouched. You're always in an upright position, okay? The head is always facing forward. The palms are facing forward and the toes are facing forward. So this is the position that you will always, whenever you're describing a structure, that you will make reference to. For example, if we just have a look at the palms, you can see actually that the portion where you would have various indentations in your hands is actually the front part of this particular person's body. That's what you would call the front part, and we'll be describing you what the terms in anatomy, what we call front. This is the front position. Anything on the opposite side, for example, if we were to flip this person over and you actually see the nails and you see the actual indentation of the elbow, you know, and you see the buttocks, that is the back part of the body. So write it down, take a picture of it. This is your reference point. Whenever we're going to describe the body to anybody, you are, whether you're talking to a doctor, whether you're talking to a pharmacist, that is the positioning that you're going to call front and back. The front is always this. Toes facing forward, palms are forward, head is forward, you're upright. That is your reference point. An example of incorrect is, I'll give an example of what had recently happened, well, not recently, probably about two years ago, what had happened with me. And I was in discussions with Dr. Rakib about a patient who walked in with swelling on this part, which is where your nail is, the small nail, a swelling on that part. And it was, I was aware of what it was, but I wanted to do some incision and drainage. And he asked me, okay, because he wasn't there, can you explain to me exactly what you want to do and where the issue is? And I said, look, it's at the front part of his hand, the front part of his thumb. Now, let's go back to our reference point. The front part of the thumb is actually not where the nail is. In terms of anatomy or the orientation, the front part of the thumb would technically be this here. That is the front part, not this. This would be the back part, which is known as posterior, but we'll get into that in a second. As a result of that, it totally changed the diagnosis of the condition. If you have swelling, that's actually at the anterior part, we'll get into this, which is the front part of the thumb. One of the differential diagnoses might be a tendon sheath infection. And a tendon sheath infection is an infection that happens to get through your skin and into your tendons. And that is something that requires possibly, you know, a plastic surgeon or a different treatment plan, not simple antibiotics and incision and drainage in a pharmacy. A paronychia or a parenchyma, where you have the nail plate and right next to the nail plate you have possibly pus, that is something that one might want to attempt to do incision and drainage. But if you start to touch a tendon sheath infection because you've described totally the different parts of the hands, it's going to be a problem. Okay, so please remember, when we are going to be saying, you know, if you do go to a doctor and say, look, it's at the front part, this is the position that you're making reference to. The back part is always the opposite. And I'll be giving you more examples on that later, but you must make sure you write it down. To reiterate, front means stood up, feet and toes pointing forward, palms are open. This is the front position of the human body. And I'm just giving you an example, if you're not able to correctly identify different parts of the human body, how would you relate to it? For example, according to this picture here, this is the arterial and the venous circulation of the legs. That whole part here, according to that, is the leg. If you have a patient who walks in and has a break, and you tell the doctor, oh, I think he's broken his leg, what part of his leg is broken? Or this person's been involved in an accident, and you've damaged or there's a possibly like a maybe like a break or a severe damage to the femoral artery. That is totally different to just saying that, oh, I think he's broke his leg, he's damaged his leg. Two separate things. You need to be able to orientate yourself the right way. You need to also be able to know what the names of the structures are. This is not the leg. From now on, for you, this is the femur, and the two bones here are your tibia and the fibula, which then go on to make, you can say, the leg, or possibly you might say this portion here between the hip and the kneecap is the thigh. So again, that is why it's important to make sure you orientate yourself the right way and you're able to precisely locate structures. If you have somebody who goes, I have chest pain, and you can't locate that chest pain is actually possibly where the heart is, you might have totally misdiagnosed that person. It is not good enough to say, oh, he's got chest pain. The chest has so many different structures. What part of the chest? Where in the chest? How do you tell the doctor, or how does a doctor in Africa, for example, communicate to you exactly more precisely where the pain is? And that is what the anatomy teaches you. So quick summary, make sure that you always know the correct anatomical orientation. Also, quick point is your right is that person's left. Definitely remember that. If you ask, when you're looking at a patient, remember that you are always in opposites normally. And if you're describing something on your right side, that is normally on their left side. Don't get confused. So that's the two take-home points there. Now, we need to quickly get into the terms and how you learn the terms and how you describe the terms. In order to do this, imagine we've got this person in front of us, and I'll have to try to explain this as much as I can so you understand this. We are now going to attempt to break the body down into different segments. So let me repeat that. What we're going to do is to break the body down into different segments, different portions. That is what we call a plane. When you're using the word plane in anatomy, what you're doing is you're creating this imaginary line that you're drawing to divide the body up. What you can divide the body up into is up, which is towards the head, down, which is towards the feet, to the left. Now remember, the left of this lady is my right. So the left and the right. We don't use up, down, left, right, back and front. There's anatomical words which will go through. But what you need to remember is, in order to use these terms, you have to know that we are drawing these imaginary lines. If you wanted to break this person up to up and down, what you're basically doing is drawing a horizontal line right through the body, and imagine you've divided the body into up and down. Think of it like a Snickers bar. When you break a Snickers bar in half, you've literally divided into up and down. That's what you've done. You've literally, imagine you've managed to break this person. You've sliced right through here. You have an up part and a down part. If you wanted to break this person into left and right, have a think about, I'll give you give you about 5 seconds. Have a think about which line you can draw to break this person down into left and right. So if you've, hopefully you've been able to understand this, and if you haven't, I'll explain it. So if we want to break the body down into up and down, we draw an imaginary line right through here, like a Snickers bar. If you want to divide the body into left and right, imagine drawing a vertical line right through the center. Literally imagine you've got, like, this is probably not a great example, but imagine you have a samurai sword and you literally decide to just slice that person into two portions, left and right. Not up and down, left and right. That plane that's dividing the person into left and right is known as the sagittal plane. That is where you've divided this person into a left portion and to right portion. It's an imaginary line that's drawn right through the center. And you're going to come across this in an anatomy book. They call it the medial sagittal line. When you divide something into left and right, your reference point is an imaginary line directly halving your body into equal halves. Imagine you wanted to draw a line to divide the body absolutely perfectly in the center, where the left side and right side are equal. That is an imaginary line that we use as a reference for medial. We're going to get to that in a second, and I'll explain that again. When you divide the body into left and right parts, you've drawn an imaginary line right through the center, and you divide it into left and right. The line has to be right in the center, like this particular person here, right down that center. Anything that's close to that line, we will then describe it as medial to another structure. I hope that makes sense. Can I possibly, we probably want this show of hands actually, we'll probably have to move on, but I will try to give you guys an opportunity later on to ask questions if we get the time. Let's move on to the next slide then. And again, I've just drawn it a bit bigger for you to understand, so we can divide the body into a front portion and a back portion by making this horizontal line, this vertical, the horizontal line going right through, and that makes a front and a back. We've got a vertical line that can go through here and divide the body into right and left. And we'll put that into practice now. So these terms are your anatomic terms. These are the anatomical terms that you're going to be using whenever you're describing two structures. I've highlighted something here, and that is that you can only describe or use these terms with reference to 2 points. You cannot say something is up or something is down without comparing it to another structure. There has to be a reference point. Always has to be a reference point, remember that. For example, let's use the word anterior. And you might want to write this down. Anterior means the front of the body. So imagine you now draw a line. You're going to draw this horizontal line right through this person and slice this person in half right here. Right there. You've sliced right through. So if you look, you've got this part here would be back, and this part here would be front. You've sliced them right here, right down this part here. And you can see this plane here, this line here has cut right through him here, and you have a front and a back. So imagine you wanted to use that term now. If we take the belly button as an example, you can describe that the belly button is anterior or is towards the front of the body more compared to, for example, the intestines. Why? Because the belly button is closer to the front or to the topmost layer of the skin than your intestines are. So the belly button is anterior. The belly button is anterior, but it can only be anterior when you're describing it relative to another position. You can't just say that you know, this is anterior, you would always need to describe. And I'll give you an example in a second. So when you're looking forward, it's anterior. When you're talking of structures behind, it's posterior. Always look at the anatomical position. Palms are forward, feet, toes forward, looking straight on. If you turn it around, then your anterior and posterior are going to be totally wrong. Back, the medical term is posterior. Up or down, when you divide the body, and imagine you divide the body again into two portions. So we're now drawing a line going right through here, a Snickers bar. Superior means it's closer towards the head. Inferior means it's closer towards the toes. For example, the navel, okay, is superior compared to, let's say, the reproductive organs here, or the pubic bone. However, if we compare this point, the nipple, with the navel, you now understand that actually no longer is the navel superior, the navel is actually inferior to the nipple. Why? Because if you look at the 2 points drawn as A and B, the A that we're using now is the nipple, and the B that we're using is the navel. When you're comparing these 2 points, they now, the orientation is the same, but where they lie in comparison is different. Another example I'll give you is of the knee. If we compare the knee to the pelvis, we can say that the pelvis is superior to the knee, or the patella. That's the medical term for the knee, for the kneecap, patella. But actually, the knee, or the patella, is superior to the toes. So that's why I highlighted this. You can't just say, oh, the knee is superior to what? Superior to what? Has to be 2 points. Or the abdomen is anterior. Well, the navel is also anterior. The trachea is also anterior. When you say it's anterior, meaning it's towards the front compared to what? Always 2 points. Left and right is pretty straightforward. Imagine that imaginary line that you've drawn here, right in the center. You've got that samurai sword and you've just sliced this person in half. You now have a left and you have a right. Anything that is closer to this imaginary line is medial. Medial, and the definition is there, describes the position of the structures that are closer to this imaginary midline. I want to explain that again. Imagine you get a samurai sword and you slice this person beautifully in the half. Imagine this line that's drawn that separates you in exactly 2 parts. Anything that is closer to that line compared to the other line will be medial. Anything that's further away will be lateral. For example, the shoulder is lateral to the chest. Why? Because if you look at point A, which is the shoulder, it is further away from that imaginary line in comparison to the chest. However, conversely, you can say that the chest is medial to the shoulder. Why? Because it's closer to the midline compared to this. When you are using these terms, just remember your reference points. Once you get the hang of it, it's straightforward, but you need to really think and get the hang of this. I am tempted not to explain the words proximal and distal, but I will explain it to you without you getting confused, I hope. Proximal and distal are only used when you're talking about positioning up and down, when you're talking about limbs. If you want to describe that this elbow fold here, for example, is superior to the hand, you have to use the word proximal. Why? Because when it comes to the limbs, whichever is closer to the incision. So if you imagine the human body and take away the hands and the arms, you take away the arms and the legs. The arms insert into the shoulder and the legs insert into the pelvic girdle or the pelvic area. And any point that is closer to the incision is known as superior. For example, the elbow fold is proximal to the thumb. Basically, what we're explaining is that this part is closer to the incision in comparison to this part. The knee is proximal to the ankle, but the ankle is proximal to the toes. Why? Because the ankle, this distance here from here is less than going from this distance of the toes all the way into the pelvis. That is the only time that you'll be using the words proximal and distal. Distal is the opposite. For example, you could say the kneecap is distal to the, you might have a point here on the anterior portion of the thigh, and you could say the kneecap is distal to that point, or you can say that that point here is proximal to the kneecap. So that is what they mean. You're going to have a read of this and get your head around this, but it's something you have to imagine this in order to use these terms. So what you need to make sure that you're aware of the correct anatomical orientation. Make sure that whenever you use the terms, you're always thinking of the various parts in comparison to another part. You're always comparing and contrasting. If something is closer, it's closer to what? Why is it closer? It's closer than the other point, okay? Spend time and get your head around this. It took me, between you and me, it took me about 2 or 3 months to really understand what these terms actually meant, because when I picked up an anatomy book, it just says to you, this is anterior, this is posterior, this is lateral. They do explain it to you, but you need to really get your head around it. Think of the samurai sword, think of the Snickers bar, think of slicing that person, and then you'll understand, okay? We've got 15 minutes and we're going to start to touch on, possibly we won't complete the thorax, but we will try to complete the thorax and finish it off next week. So I'm going to start to touch on the thorax now. So let's go on to the thorax. So what is the thorax? The thorax is the medical term for basically it's the chest. Okay, that's what we call the thorax. This here, everything that's here, which includes the ribs, this cartilage, we'll get to in a second, the sternum, which is the breastbone, this is all the thorax. That's what we call the thorax. From now on, you're not going to call the chest the chest. If you're making reference to the lungs, you mention lungs. If you're discussing with somebody and you want to talk on the scientific level, this is known as the thorax. The thorax has 3 major constituents. In actual fact, there's 4, which I'll get to in a second. The 3 major constituents are the ribs, which is the blue parts here, the costal cartilage. If you don't know what a cartilage is, search it up. Bones and cartilages are different. I'll briefly touch on this, and you can write this down. There's 4 major tissues in the body that make up all the other tissues. There's 37 trillion cells that combine to make 4 major tissues. You have nervous tissue, you have the muscle tissue, you have the connective tissue and epithelial tissue. Write it down. Epithelial, nervous, connective, and the muscle, the muscular tissue. 4 tissues, and these pretty much make every single part of your body. The blood is a connective tissue, tendons are connective tissue, the lining of your mouth is an epithelial tissue, nerves are nervous tissue, muscles, for example, whether it's skeletal muscle, whether it's cardiac muscle, whether it's smooth muscle, that is a muscle. It's all these 4 terms. Remember that. And a cartilage is a special type of connective tissue. Just keep that in mind, okay? So here we are, we've got the thorax. The thorax is made up of the ribs, the costal cartilage, and it is made up of the sternum. You have to just remember this. There is no way that I can explain it in a way that you'll be able to understand. You just have to memorize these terms. By the way, the sternum, the colloquial word for sternum is the breastbone. The colloquial term, I guess, for the ribs and the costal cartilage is known as the rib cage. And behind here, this big column here, which is actually causing me a bit of back pain, is known as the spinal column, okay? And we call that the vertebral column. Let's break the thorax down into separate components. So we're going to now look at the rib cage, the sternum, and the vertebral column. The ribs. So the ribs are basically divided into these different sections. You have 12 pairs of ribs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. If you didn't know, just have a look at these 2 ribs here. They actually don't connect to anything. These ribs are called floating ribs. Why? Because these ribs do not connect directly into the sternum, or neither do they connect with any of the costal cartilage. True ribs are all the ribs that directly connect into this breastbone of the sternum. They're known as true ribs. Look at this. Direct connection, direct connection, direct connection, direct, direct. Direct. This rib here, rib 7, 1, 2, 3, 4, 5, 6, 7. He's minding his own business and is connecting himself into this sternum. But look at these 3 guys. They've just joined on the bandwagon. They're not connecting directly into the sternum. They've joined with that rib. So these are known as false ribs. Why they're false ribs is because they do not directly, independently of any other part of the ribs, connect into this breastbone. That is what you need to know. The ribs, there's true ribs, false ribs, and floating ribs. Now you can imagine why they're floating, because they don't really connect to anything, they're just there. Okay? I've highlighted intercostal space because just remember one thing actually, these are ribs, that's cartilage. Please, please, please don't call them, these are not bones, these are cartilage. Okay, the ribs are made up of bones and cartilage. In between the 2 bones, you have an intercostal space. You need to just memorize that. In between 2 adjacent ribs, you have an intercostal space. Tough luck, just learn it. So I've explained to you, and just remember, there's 12 pairs of ribs, 1, 2, 3, all the way till 12. The ones that connect directly into the body, or the sternum, which will go the breastbone, are true ribs, and there's 7 of them. 1, 2, 3, 4, 5, 6, 7. The remaining ribs 8 and 9 join on the bandwagon, and the other ribs are floating ribs. In between the ribs, we have an intercostal space. Intercostal space. So whenever you hear the words like anything to do with costal, normally refers to the ribs. You might hear the word, the costal vertebral angle. Again, it's probably also linking with the vertebral column as well, which we'll go through in a second. So costal has to do with all these bony structures. In between, you have space. Summary, there's 12 pair of ribs, just memorize it. There's true ribs, which are 7 true ribs. You have 8, 9, 10 are false ribs. Why? Because they don't connect directly into the breastbone or the sternum. And you then have the 2 ribs that just are not doing really anything. You know, they're a bit alone, like I am kind of sat here at the moment. And they're just there. The next, we're going to look at the spinal column. Okay. The medical term for the, and just have a look, you know, what I've actually done here. I thought it was quite smart. I've used the word posterior. I'm just going to go back onto the slide. Do you understand why this is the anterior view? Because remember the anatomical position. Think of it yourself. This is exactly the way your chest is formed. That's the anterior view. If we flip it around backwards, it's the posterior view. I hope that makes sense. If you can't remember, get the drawing out and have a look. And that's why I mentioned actually as a reminder to remind you guys, look, that's the anterior view. Now, if we were to look at the spinal cord or the spinal column from here, do you think that's anterior or posterior? That is, from this position, that is anterior. Because it's in exact line with the way that you would actually be viewing in the anatomical orientation. I'm not going to go back to that. But anyway, this is the anterior view. When we look at the ribs, this is the posterior view behind here. The vertebral column, which you will now call the vertebral column, don't call it the spinal column, don't call it the spine, it's the vertebral column. Learn the term. The vertebral column is made up of 1, 2, 3, 4, 5 different sections. And you would have definitely come across this somewhere in your practice. You would have heard the word C1. Oh, he's hurt his C1. He's got pain in his T2. He's got pain in his L5. Or he's had the break in the disc is between the L4 and L5. That's what it's making reference to. They don't just say, oh yeah, he's got a break in the spine. Look at the spine, it's humongous. You can't just say, oh yeah, I think he's got pain in the spine. Nerves come out of these spines. It's 2 separate things. If you compress, for example, nerves 3, 4, 5, that could really affect the shoulder as well. Because you have those nerves go on to, the cervical nerves go on to connect into the axillary inlet. We won't discuss that, but they combine into a particular, they innovate, or they go and provide nerve feelings into this part of the shoulder. So just remember that you have these different sections. Learn them. The first 7 bones or vertebrae or vertebra. Vertebra is singular, vertebrae is plural. So the first 7 vertebrae are the cervical vertebra. Cervical relates to head and neck. Have a look where it is. It's right where your neck connects. This is no coincidence that this is known as the thoracic vertebra. Why? Look at the thoracic cage. It's right there. You see your rib cage? Right the way from rib 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Thank God they've done it as 12. You've got 12 right here. That's why this region is the thoracic vertebrae. This is the lumbar, and there's 5 vertebrae here. The sacrum and the coccyx. The word fused, and you'll see that is because when you actually have, if you ever do dissection, actually look at these two bones, it's actually like a single bone. And that's why they say that there are 5 small little projections, 1, 2, 3, 4, 5, but it's one big fat bone, and they call it fused. That's all it means. Don't get confused. That's basically what it means, is that it's fused. Okay. Here I've put for you the different vertebrae that you have. So the cervical has 7 vertebrae, the thoracic has 12 vertebrae, the lumbar has 5 vertebrae, the sacrum here has 5 vertebrae, and the coccyx has 4 vertebrae. let's move forward and let's have a look at the two structures we've learned. We've learned the ribs, or the thoracic cage, you call it. You know now that there are 12 pairs of ribs. We know that this is a bone, this is a cartilage. We're going to get into this structure in a second. We know that you have true ribs, which are ribs that connect directly into the breastbone. We know there's false ribs which don't connect directly. They'll have to jump on the bandwagon and then go into the body or the sternum. And then you have these guys here who are just all alone and have got nothing better to do than just look around. We've then now divided the spine or the vertebral column into 5 regions: cervical, thoracic, lumbar, sacrum, coccyx. So next time you see a discharge letter that says the person had a fall and broke his T2, T3, you'll know what it is. How you locate them we'll be discussing later, but you'll know, okay, he's talking about that region in the spinal column, and that relates to the thoracic region. I think we'll quickly touch on I'll quickly finish on the sternum, and then I'll give any opportunity to ask questions, and we'll finish this off next week, I think. So let's quickly have a look at the sternum. The medical term for the breastbone is the sternum, and it's basically this here, that right there. It's like a sword, actually, having thought about it now. It's like a sword. It's got 3 parts. It's got the manubrium. Why they call it the manubrium, I don't know. The body, normally the biggest part of the bone is known as the body. That's what they normally call it as. So because if you look at this particular bone, the biggest part, and I apologize if you run slightly over 7:30 or 8:30, sorry, it won't be any much longer. This is known as the body. And here we have the xiphoid process. I'm not sure if you know what the word process means. Again, these are those funky anatomical terms that you have to learn. And the word process is basically like a projection out of a larger bone. For example, the big bone here, which is the body, you have this thing that hangs out. That's the process. If we go back for a second and have a look at these things that are hanging out, these are also known as processes. Spinous processes, these are known as. Why? Because they hang out the spinal column and they call it a process. Just don't get confused, because you'll see it a lot in anatomical texts that, oh, look, you know, this is the spinous process, or this is the acromion process. For example, I did a video about how to inject safely. What's the acromion process? It's basically the acromion is a bone, and the projection is known as a process. It's the part you can actually feel. And for example, if you feel the back of your neck, what you're feeling is the spinous process. You're not feeling you're not feeling the entire vertebrae. That part there that you can feel in your back is the spinous process. Anyway, we have the manubrium, the body, and the xiphoid process. We have these notches. Again, another anatomical word, and the word notch can mean 2 or 3 things. It could mean just an indentation, or it could mean a hollow opening. In this particular case, it's normally like an indentation, and we won't get into that, but just remember that a notch can mean a hollow opening or an indentation. We have 3 major components: the manubrium, the body of the sternum, and the xiphoid process. I won't explain what a facet is. It'll just get confusing. But a facet is just literally like a smooth part of the bone. That's what it basically means. So we're going to end it here. Then we'll quickly go through question is a summary. What I've gone and explained to you is I've explained to you the anatomy and described the various structures of the chest or the thoracic cage. You now know that there are 12 pair of ribs. You now know that there are true ribs, false ribs, floating ribs. You also have learned the 5 different regions of the spinal cord, the spinal column. You've also learned actually that the breastbone is known as the sternum, and there are 3 different parts. I'm going to quickly give you guys a chance to ask questions. I'd like you to just make sure if there's anyone who's not got their head around anterior, posterior, lateral, let's start on that first. If anybody wants to raise a hand first, you're more than welcome to do that now. I can't see any hands being raised, so my understanding is that I'm guessing there are no questions to ask. Let me just ask you one by one. Michael, can you hear me?
Yeah.
Any questions?
No, it's been very useful. Thank you.
Perfect. Thank you. That's fine. I'm just going to quickly, Alex, I'm just going to allow you to be able to, Alexander, do you have any questions? Alexandra?
Yeah, sorry, I was on mute. Yeah, it was great. Thank you.
Perfect. That's fine. No questions. Good evening, Bobby. Bobby, can you hear me? No. I think what we'll do.
Can you hear me?
Yeah, Bobby, I can hear you. Any questions?
No, it was crystal clear. Thank you.
Perfect. Thank you. Many thanks. I'm guessing you've not raised your hand, so there are no questions. I think we should carry this on next week. Just to give you a quick discussion of what we're going to be doing next week, so you have a bit of an understanding and you can read it, is we're going to be looking at how you put this into practice. You're going to be looking at how you can listen to the chest, where you put your stethoscope, and how you listen to chest sounds. That is what we're going to be doing next week. So I wish you all a great evening. Thank you for your time. And if you have any questions, just drop me a message. I will send you a text. I've seen who's attended just to see how you found it and your evaluation. And God bless you all and have a good night.